JJ, at this Delta Area Summit today, one of the topics was healthcare, and it was an important issue for you. You were saying that the healthcare facilities, especially emergency care, not strong enough in the Delta area. So you had some ideas on that.
It's non-existent in the Delta area. We don't have a facility for emergency services. We don't have an urgent care center. So what we're seeking is some better services. This is and one of the interesting points is, and a lot of people forget this is a tri-county area. Our service area is large. We encompass, the eastern part of Hidalgo, southern part of Willacy, and the western part of Cameron County. And we service a lot of people, as you saw during the presentation. But there isn't a hospital here. There isn't an urgent care center. There isn't a micro hospital here. So our residents, heaven forbid there's an accident or an emergency of some sort, have to travel 20 miles to the west or 20 miles south to one of the hospitals. So we are in dire need of a medical center.
And in that discussion that followed, once you brought the subject up, there was discussion about how big an area you have, and there was the discussion on how many people visit the Walmart, for example, how many people travel through certain parts of the Delta. And the consensus was in the room here that you have the population that deserves an emergency care facility.
Well, we have some major thoroughfares, 107, FM 88 also getting expanded, 107 getting expanded, Monte Cristo getting expanded, 1015, Mile 6. These are all major thoroughfares. There's a reason they're getting expanded because we're seeing the high traffic. High traffic means, high volume. So there should be some kind of medical facility in this area. And I think people are missing out, honestly.
Did you say as well that you had visited or wanted to visit some of the major health systems in the region to ask why they're not here?
We've had multiple conversations with healthcare providers and have yet to yield any results. A few years ago, we were trying to go on our own and even try to bring in our own medical facility. And unfortunately, COVID hit and that just fell by the wayside. But yeah, we've had multiple conversations still to this day, always seeking healthcare facilities. It doesn't stop for us.
And one of the folks in the audience here was a former elected official, I think a former mayor, or Mr. Eddie Gonzalez, and he was saying that these discussions were taking place 20 years ago with certain health systems, and surely since then you've grown, and nothing happened.
I think it's an issue of legitimacy, and this summit is a first great step for us. It establishes collaboration and legitimacy in that there's new leadership in this area. There's a lot of growth in this area, and it's time for us to get a medical facility.
And then just a last question, not so much on the medical situation, but your cooperation as a whole among the three cities here, the four with Monte Alto. There just seemed to be a lot of goodwill and a lot of sharing of ideas and people were saying that the leadership now is new and is receptive to working together. That seemed to be the whole overriding theme of the discussion.
Well, like I mentioned earlier, I think that this area has been overlooked and underserved, and a lot of it's been our fault. We've never been able to come together like this and work collaboratively on a project. So baby steps, right? This summit is baby step number one for us. And I think that you read the room. I think everybody seems motivated and ready to go. And I'm excited. I'm looking forward to working with everybody and growing this area.